Now it's time for session 2 panel discussion. I must say special thank you to all speakers for this additional recording to compose panel discussion. We, as Korean TF team, had preview all presentations and decided to present the organization of TF team. Hope every country who want to manage telemedicine center gets some idea from it. I will ask Dr. Song to present this. Dr. Song, would you do that now?
Yes, I will. For the audience, Dr. Choi and I discussed about presenting organization chart of COVID-19 TF team in ACOM. There is control bureau for planning, roll calls, advertising, and overall control. The chairman is Dr. Choi here. We made up 3 parts with the telemedicine center, supporters, and academic and clinical committee. Telemedicine center is consisted with the medical doctors doing telemedicine and service team doing preliminary checkup, herbal dispensary, and delivery. Supporters is consisted with managing team doing fundraising and money management, and supporting team for data networking and medicine supply and demand control. Academic and clinical committee is consisted with 3 parts. The chairperson is me. First, clinical guidelines development team conducted by Dr. Zhang here. Second, medical advisory group led by me. Third, data construction team conducted by Dr. Lee Eun-kyung here. This is the workflow of COVID-19 telemedicine center. We catch our call from patients and ask whether COVID-19 confirmed case. If no, quit. If yes, we get agreement on personal information sharing. If no, quit. If yes, we start medical consultation. If the patient doesn't need medication, we do observation with telling them self-caring guide, warning signs, and keeping in contact with telemedicine center. If the patient needs treatment, we prescribe herbal medicine with instructions, checking signs, and in-call services every 1 to 3 days. All of our medical practice has been recorded in EMR and diary record. Through this process, we've got demographic and clinical data and published these articles in various journals. And this process was still going on. In Korean session, Korean speakers treated these researches. Thank you.
Thank you.
And now we will do session 2 panel discussion with answers from all. For the audience, I'm letting you know that this overseas session has been recorded by each and composed in one. Here is an email address on the bottom. We will support replies from speakers on your questions also. Questions are: first, would you say some about your impression as a traditional medicine practitioner's experience on this COVID-19? Second, what do you think about post-COVID-19 and any opinion on necessity of global network to use traditional medicine for epidemic diseases? Greece.
Audience addressed 2 questions for me. The first is to give my impression regarding my personal experience on this COVID-19. And I want to tell you that here in Greece, we didn't use traditional medicine, herbs or acupuncture in this pandemic. I have seen my office only post-COVID patients, and I use acupuncture for immune protection in healthy patients. Also, I use acupuncture for problems caused by quarantine, like insomnia, stress and anxiety, depression, and chronic musculoskeletal pains. Because to work at home means poor work hygiene, so We have many patients with cervical problems, with hand problems, and we see that kind of patient in the office, that our office are open now, despite quarantine. The second question is to say my opinion about the necessity of a global network in order to use traditional medicine for epidemics. And of course, I believe that a network of any kind is essential in dealing with pandemic. Either traditional medicine or Western medicine, it's of important value for our patient. And it is a challenge for all of us to create guidelines in order to help our patients. But unfortunately, we are not post-COVID yet. Thank you for your attention.
Hong Kong.
Hello, everybody. It is very great I can hear the different speakers' experience in traditional medicine for COVID-19. For this panel discussion, I would also share some of my experience or opinion for COVID-19 in Hong Kong. The question from Dr. Song. Number one, would you say something about your expression as a TM practitioner's experience on this COVID-19? As I said in my presentation, there are two legal medical systems, Western medicine and Chinese medicine in Hong Kong, Macau, Taiwan, and mainland China. However, Chinese medicine treatment for COVID-19 is not allowed in hospital because there is no Chinese medicine department of infection diseases or Chinese medicine hospital in Hong Kong. It is possible for exploring Chinese medicine prevention and rehabilitation of COVID-19 in Hong Kong. So we began to do Chinese medicine prevention of COVID-19 susceptible population in Hong Kong, and hospital authority and local Chinese medicine in Hong Kong also began to do Chinese medicine rehabilitation of COVID-19. For example, I also saw a COVID-19 rehabilitation patient with menopause dysregulation, and the patient was treated by Chinese herbal medicine for 1 month and now recovery completely. I know some of the speakers have used traditional medicine for COVID-19 in different countries. Anyway, we should think about legal issues for using Chinese herbal medicine or not in Hong Kong, while professional issues in Chinese medicine are not problem because there are lots of experts in Chinese medicine in Hong Kong. Some Chinese herbal formula for COVID-19 have been reported by scientists of mainland China and have been registered in Hong Kong, such as Lianhua Qingwen capsule and Hexiang Zhenqi San. So we may use registered Chinese medicine formula or create new prescriptions for COVID-19 in coming years. The experts of Chinese medicine can have TCM treatment protocol of COVID-19 for Chinese herbal medicine or acupuncture, according to Chinese medicine series, holistic view, and symptom-based treatment. For number 2 question from Dr. Song, what do you think about post-COVID-19 and any opinion on necessity of global network to use traditional medicine for epidemic diseases? First, SARS-CoV-2 may come again, and COVID-19 may repeat continually, according to various authority reports from the various famous universities. Second, vaccine can stimulate body-specific difference, but its long effect is not known, and we can strengthen general body defense by traditional medicine. Third, nowadays we still face a big challenge in COVID-19 and new pandemic diseases. This needs drive us to explore new therapeutic strategy and new drug from traditional medicine. One of the advantages is Chinese medicine always has prescriptions for any existing diseases and new emerging diseases, even though we don't know what pathogen induce the diseases. In modern conditions, what we have to do is to prove scientific and clinical evidence for traditional use, and we can build a global network to use traditional medicine for epidemic diseases and do more research for any other epidemic diseases treated by Chinese medicines. I think this conference have provided good relationship among us to build such a network to use traditional medicine for epidemiological diseases and collaboration among us. Thank you. Thank you for your attention. Thank you very much.
Japan.
Thank you for your question. My answer, it is important to treat as dampness pathogen and to use half exterior, half interior target therapy from the beginning to end, to use gypsums for high fever and to therapy for blood stasis and blood fever for severe ill people. And it requires treatment for relatively long time, so that I think the effect is good. The sequelae of COVID-19 are C and blood or C and E deficiency, in addition to blood stasis and phlegm in heart system and lung system, which can be resolved by early treatment target them. Next question. Answer my answer. I think it is necessary to establish a price for information rapidly sharing. For example, a system for sharing information on specific symptoms, and this was a pattern of traditional medicine. Thank you.
Germany.
Dear moderator, speakers and audience, I feel particularly honored to have been asked by Dr. Mi-Juk Song to answer some additional questions. I may have neglected to do so initially because it feels a bit strange for an ordinary general practitioner to talk about Asian medicine concepts to Asian people who are real academic professionals on the subject. I just don't want to seem presumptuous. So my impressions from the point of view of a TCM practitioner in Germany is somewhat mixed. Sadly, complementary medicine concepts in general are somewhat neglected to the public, by the government too, and by media and press also. On the other side, they buy drugs like remdesivir for hundreds of millions, which we know is not really effective. And people seem to hope that we will all get our vaccinations just after Christmas and then get rid of Corona. In contrast to that, my personal experience as a medical doctor in treating COVID-19 with Chinese medicine, as well as the reports from fellow doctors who consulted me for the treatment approaches, are very good. Every person I know of in this context as well and didn't need to go to a hospital. But please keep in mind there's only personal experience and no systematic observation. When thinking about the question of what to do in post-COVID-19 era, the question comes to mind, when does that time really start? Besides the necessity of treating post-infectious chronic COVID-19 diseases, I'm reminded of chapter 36 of Tao Te Ching, where I'm meant to learn that if there's something we wish to overcome, we have to accept that we will get strong first. And I'm personally afraid that we as humankind do have to live through this phase yet. But I'm convicted that we have to live through this together and have to put aside political differences and economical greed for once and for all, if you ask me. So yes, of course, we do need a network of practitioners of traditional medicine. Let's get to work. Thank you again, and best wishes to all of you.
Taiwan.
Ladies and gentlemen, good afternoon. It's a time of Q&A. The first question, would you say something about your impression as a peer practitioner experience on this COVID-19? The two photos is I wear isolated clothes at the time. Everything is the first time. When the outbreak of severe acute respiratory syndrome SARS threatened the world in 2013, I was an R2 doctor. I worked in traditional Chinese medicine department of China Medical University Hospital, Taiwan. We need to wear masks, check body temperature and the respiratory syndrome every day. The same situation and now. Facing SARS, I fear the terrible pandemic for the first time. I could do nothing for SARS patients at the time, but now I wear isolated clothes and entering the negative pressure isolated ward to breathe and treat COVID-19 patients. I didn't feel any fear in my heart. I just thought that I need to use Chinese medicine to help a COVID-19 patient, especially there were no effective drugs or vaccine to use in these times. I am happy that I confirm Chinese medicine can help a COVID-19 patient. And this afternoon, I share the experience of Chinese medicine to treat COVID-19. I hope more and more patients suffering from COVID-19 could accept Chinese medicine treatment. The second question, what do you think about post-COVID-19 and any opinion on the necessity of global network to use PM for pandemic disease? According to the result of the normal traditional Chinese medicine formula, Taiwan Qingguan Yihao NRICN 101 has been administered to patients with COVID-19, which designed by National Research Institute of Chinese Medicine NOHW. I just say there are 4 key points. 1. A herbal-based formula delivers positive clinical outcomes on COVID-19 patients. The second, the formula inhibits SARS-CoV-2 pathogenesis in antiviral and inflammatory assays. 3. Real-world evidence offer insight to inform drug development. 4. Back-to-bench approach shortens the time required for finding effective therapies. At the present, there is still no effective treatment for COVID-19, and the vaccine is still in the stage of evaluating its effectiveness. It's necessary to expand the use of traditional Chinese medicine to treat COVID-19 and to find effective compounds to treat COVID-19. Thank you.
USA.
About my opinion is a TM practitioner's experience on this COVID-19. Traditional medicine is essentially the first to determine the nature of the disease, identify the cause of the symptoms, and come up with the treatment method. I think this basic treatment process can quickly assess infectious diseases whose cause is unknown in Western medicine. In addition, research to prevent viruses such as Chengmyeong is ongoing, and Chengmyeong is actually effective in treating colds and flu. Also need help to reduce COVID symptoms due to our data. Necessity of a global network to use traditional medicine for epidemic diseases. As we learned from the case of COVID-19, with the full support of Association of Korean Medicine, AAKM was able to quickly set up U.S. phone consultation center and was able to respond quickly based on Korea's experience. Also, this conference is a good example for global network, even if it's not an epidemic. I think that a global network is necessary. But in the pandemic situation, I may say it is absolutely necessary and not something to consider.
Austria.
And there was a question, would you say some about your impression as a DCM practitioner's experience on this COVID-19? And as I said, my experience is very positive. We need experienced, well-trained doctors. We need structures so we can treat people effectively. And it would be very important to get access to people who are exposed to COVID in hospitals, in retirement homes, and so on. And the second question was, what do you think about post-COVID-19 and any opinion on necessity of global network to use DCM for epidemic diseases? It's happening already. I'm talking here for you at the conference in Korea. We got a lot of information from China. We share a lot of information within our community of DCM doctors and practitioners. And so, but it can always improve. And I would say, let's gather and exchange data and knowledge from east to west, from north to south, and let's establish good criteria for case studies. And so let's go and drive forward the research and the use of databases for the benefit of all of us. Thank you very much.
Thank you for your answers. As a moderator, it's a great challenge of traditional medicine on COVID-19. Traditional medicine usage is getting known to many people as an effective treatment on light and mild symptoms globally. And monitoring patients via many devices by medical doctors is important. But government support is very necessary in all countries, as we know only China does. From this conference, Korea is suggesting global traditional medicine network for epidemic disease to share information.
I agree. We have to gather evidences and results from all of us. Especially, I was impressed with the cases of Japan. I guess the integrated medicine will be our future. There are many academic societies of traditional medicine in the world. Let's do this together.
Now we close this international online conference. Our release will be related for long with the Korean Medicine Online Promotion Center website. Thank you for all, and hope you stay healthy till this pandemic ended. Thank you.
Thank you.